Why is overflow incontinence so hard to diagnose? Imagine trying to solve a puzzle where some pieces are hidden or look very similar to others. That's often what doctors face when diagnosing overflow incontinence. It can be tricky because the symptoms are subtle and easily mistaken for other bladder issues. People might notice they are leaking small amounts of urine constantly or feel like they never fully empty their bladder. But these signs can also happen with other types of incontinence or bladder irritation, making it hard to tell what's really going on just based on symptoms alone. The causes behind overflow incontinence are also quite varied. It happens when the bladder doesn't empty properly, leading to urine building up. This can be due to weak bladder muscles, nerve damage from conditions like diabetes or spinal injuries, or blockages, such as an enlarged prostate or urethral strictures. Sometimes medications can interfere with bladder function too. Because these causes are so different and can even occur together, pinpointing the exact reason requires careful investigation. Diagnosing overflow incontinence involves multiple tests, and none of them alone can give a complete answer. Doctors often start with a physical exam and then use special tools. One common test is measuring how much urine remains in the bladder after urination, called a post-void residual measurement. If it's over 200 milliliters, it suggests the bladder isn't emptying well. They might also do urinalysis to check for infections or other issues. Urodynamic testing is another step, measuring pressure inside the bladder to see if it's contracting properly or if there's an obstruction. Imaging tests like ultrasound or cystoscopy help visualize the bladder and urinary tract for structural problems. Because these tests can be invasive or uncomfortable, they are often done in stages, which can delay diagnosis. Another challenge is that patients may not always report their symptoms clearly. Embarrassment or not, recognizing the significance of dribbling or frequent urination can hide the true extent of the problem. Symptoms can also fluctuate over time, making it harder for doctors to catch the pattern. Plus, overflow incontinence often coexists with other bladder issues like overactive bladder or stress incontinence, which can muddy the waters further. Medications and other health conditions, such as diabetes, can also affect nerve signals and bladder function, adding more layers of complexity. From a bladder health perspective, getting the right diagnosis is vital. If overflow incontinence is left untreated, it can lead to urinary tract infections, bladder stones, or even kidney damage. These complications can make it harder to detect or treat bladder cancer, which is why thorough evaluation is so important. Each person's experience is different, and a tailored approach is necessary. Medical professionals often need to piece together multiple clues to arrive at an accurate diagnosis, ensuring the right treatment plan is put in place. So, the reason overflow incontinence is so difficult to diagnose is because its symptoms are subtle and overlap with other conditions. Its causes are diverse and sometimes hidden, and it requires a combination of specialized tests to confirm. This complexity highlights the importance of consulting healthcare providers who can perform a comprehensive evaluation. Remember, every individual is unique, and proper diagnosis is key to managing bladder health effectively. Always seek personalized medical advice if you experience symptoms of urinary incontinence.